That's
That sounded like Alec.
Okay, are we live?
almost.
Takes time. This is good. It's because we have a day like this.
It's better than having a full slate. Get that stuff.
Yeah, we're live and we have video.
All right. Thank you. Thanks, Alex. And thank you, Kiki. And this is Senate Health and Welfare. It is January 3rd, 2024. Welcome. And we are beginning our meeting. It's the first meeting of the second year of the biennium. So we will be hitting the ground running pretty soon. Before we begin, I would like to have our new committee assistant introduce herself so we get to know her. And Kiki, or can you do that? You all set? Good. And so why don't you introduce yourself and for folks, and we'll introduce ourselves as well.
My name is Kiki Karazi Schwartz. I just graduated from UVM in May. My folks live down in Brattleboro, so I've lived in Vermont for quite some time. I majored in global studies at UVM and then minored in food systems, ecological agriculture, and community and international development. So a wide span of stuff. And yeah, I'm really excited to work with you all.
Welcome. And just to say that Kiki, last Friday, just before the New Year's weekend, I was informed I had a different committee assistant who I worked with and met with by Zoom. And then I heard that Kiki was taking his place. So we are really lucky to have you and welcome you. Thanks for being here. So she's been on a very steep learning curve, and I haven't let up. She's going to help us. She'll be doing well for us. So if you need to contact me or leave me a message and I'm not around, Kiki is happy to do that. Good. And so why don't we go around the table and introduce ourselves for her and for others in the room and for the folks who are up on the screen, and then we can have a committee discussion. I have some things I'd like to share, and then I know you have some things you want to share. So start with you, Senator.
Good morning. Dave Weeks, representing Rutland Council.
Hi, everybody. Senator Martine Larocque-Ulick. I am from Chittenden Central. I live in Burlington, and I'm the clerk, apparently.
Apparently. There's no apparent about it. Literal.
Hi, well, I think I know all of you guys mostly. But hi, Kiki. I met you earlier. I'm Senator Ruth Hardy from the Addison District, and I live in East Middlebury. It's great to have you here.
And I'm Senator Terry Williams from Rutland District.
And this is a really eclectic group. So you and I know each other. Senator Lyons from Chittenden Southeast. So Kiki's interests are, Kiki looked at our board and thought that this would be a great committee to work in because it looks like there's a lot of activity going on with some pretty interesting topics. And I'm glad that you have landed here. We'll use your skills and skill sets. So appreciate your quick learning curve. No, it's been it hasn't been easy. I can appreciate that. But I did give her New Year's off.
Oh, so generous of
you. No crotchets. So I just want to say welcome to the committee. This has been a really difficult between session for all of us. The flooding has not been a happy time. The housing issue hasn't been a happy time. It's been difficult. And there are a lot of things that we each would like to do. I know each one of us has been working hard during, it's not a break. between session time. And I thought what I would do would be to go through and list what I see as our priorities in the committee and what we'll be working on. And then, obviously, there will be bills that lend themselves to those priorities, but there are also other bills that we each feel very passionately about and would like to have taken up. So I want to hear about those from you. As we go ahead, we'll do as much work as we can. You know that we do that in here. We're effective at getting our work done, and we want to continue with that process. Doesn't mean we can't have fun while we're doing it. Hopefully, that's part of it. For me, it's always fun. I thoroughly enjoy being here with you all. Hope we can get our work done. And there are a lot of interested parties around the room. And why don't we do this? We have enough time today, I think, to do this. So let's go around the room and have you all introduce yourselves and who you represent. So as we're talking about our issues, we'll understand what yours are. We'll start right over here.
Christina McLaughlin, Mickenberg, Dunn Smith. A couple of our clients are Drug Policy Alliance and Health First.
Mary Kay Molman, Director for Vermont Public Policy with Bi-State Primary Care Association, and we support federally qualified health centers in Vermont. We also have New Hampshire, but I have someone else who does the New Hampshire legislature. And we also support Vermont Free and Referral Clinics and Planned Parenthood, Northern Vermont.
Nellie Marble, I'm the Director of Communications and Legislative Affairs for the Department for Children and Families.
Elena Barabee, the Director of Health Systems Finance, the Green Mountain Care Board.
Hi everyone, Amy Johnson, I'm the Director of Government Affairs for Vermont Care Partners, brand new, formerly with the Parent-Child Center, so I've worked with many of you over the years.
And you are you taking Julie Tesler's
I
place?
am.
So that puts it into
I was
perspective.
gonna say the new Julie, but it's a little different of a position, but very happy to be stepping into your giant shoes.
Thank you.
Good morning, Bridget Morris with Morris Strategies. The clients that I have in healthcare are the generic pharmaceuticals through the Association for Accessible Medicines. I also have the Vermont Retired State Employees Association, so just general health policy, and a health IT company, Gainwell Technologies as well.
Hi everyone, Rebecca Copans. I live in Montpelier. I represent Blue Cross Blue Shield of Vermont. I also, from a volunteer perspective, I'm on the Montpelier Housing Committee, so I'm very interested in anything you do on housing as well. Thank you.
Matt Levin, Executive Director of the Vermont Early Childhood Advocacy Alliance. There are a number of issues on our legislative agenda this year that we'll be considering over the course of the session.
Alex McCracken, Director of Communications and Legislative Affairs for the Department of Vermont Health Access. I'm new to this position, but not to this committee, and to all of you. It's lovely to be back. I'm here to be a resource on any Medicaid policy-related issues.
We're going to have some of those.
Wonderful.
Glad you're here. We're glad that all of you are here, frankly, and just listening to who you represent, we will be looking at bills that have some interest for you, some more than others, but certainly there. And so with that in mind, I made a very short list of maybe three priorities or more. As you know, we have a lot of priorities in here. But knowing what's happened outside in the real world, well, we've been out there in the real world, one of the concerns that we continue to have is around housing and homelessness. Act 81 we did have a meeting. We had that joint meeting with House Human Services and looked at what, if any, plan is coming to us from the administration, Department of Children and Families in particular, and Nellie, that's you. We'll be following up with housing. In particular, our one goal is to determine if appropriate services are available for folks who have chronic illnesses or disabilities or substance use disorders, mental health needs. Trying to sort out that as they're provided housing, that they are also interviewed and helped with the social service needs that they have. And then, we will be meeting jointly with, on January 18th with Senate Judiciary and Senate Economic Development, on housing and looking at it more comprehensively. So we have our own particular interests in here, but then we can't do it without having help from our folks in Judiciary and folks in Economic Development. So that meeting will be, an opportunity to hear from folks about what's happening out in Vermont, across the state. And I know, just want to say thank you to the committee for the work that you've been doing on housing, because I know that every single one of us has been involved in looking at motels, hotels, and other venues where people have been placed. Also looking at, which is not as upfront, but certainly part of the goals that we have, in looking at long-term care and what's going on with some of the long-term care facilities in our state. And that at least in my district, there are some pretty significant concerns. The other piece of housing is that we work with Human Services, and the Human Services Committee is going to be spending some time on general assistance housing and looking at that program that hasn't been updated in a long time. I won't say 100 years, it's not that long, but sufficiently long to be problematic. So we'll be looking at that bill when and if it comes over to us. Another area of concern for us, obviously, none of these are in order. You need to understand that. Everything is a priority in here. Substance use disorder and mental health supports, again, on our agenda. There's a lot going on outside of our committee on this within our local municipalities, and trying to firm up emergency responses, and how can emergency care folks deal with mental health issues and substance use disorders when they're called. And also public safety, we need to have some coordination there. So we'll be looking at a focus on mental health supports. We want to look at recovery services, knowing that how important recovery is for prevention. So when we talk about prevention, we talk about primary and secondary prevention, and recovery services are obviously at the top of the list for ensuring that people don't step backwards. So that will be part of our work. We were lucky to be able to go to Jenna's Promise before the flood, and to have that opportunity to visit there. I've been working with folks from the administration, as well as the Fletcher group, who some of us met with last year at the end of the session, on what criteria or outcomes will we use for determining how to expand something like a Jenna's Promise. So what are the outcomes that we would want to have in place, including for Jenna's Promise with their grant for their pilot program. So we'll look at that. There's a bill, it's a framework bill. We have a lot of work to do on that, and not the least of which we want to include some of the work that the advisory committee has been doing on opioid disorder and substance use disorder, and I have plans for some of that money. We'll have to talk about that, but so it's huge. Part of the work that we'll do was the substance use disorder, mental health services, public safety, emergency medical response, schools, corrections, the judicial branch. There's a lot of work going on outside of our committee, and we want to be able to maybe pull some of that together. We will have someone come in from the judiciary to talk about the mental health work that's going on there. And then trying to look at how we can stop putting our fingers in the dike and build some long-term solutions. I mean, that I think is really important as we continue to put harm reduction in place, but we don't have the long-term systemic planning and work. So that's another important issue for us. Kind of obvious, isn't it? Something important. And then healthcare reform is an area that we have been working on. Act 167, you have the Healthcare Reform Oversight Committee slide deck I put on your desks from the meeting that we had this fall on Act 167, an update on what's going on there with the Agency of Human Services and the Green Mountain Care Board, which Alina is going to help us with. But there are healthcare reform is alive and active. Some would say it's going too slowly or not in the right direction. But as we know, we have been through a transition from thinking about having a single payer in place automatically to having some alignment of our public and private payers, so we can build a system of care that is equitable and provides for equitable health outcomes, so quality outcomes. The bill that we have, S-151, up on the board is one we will look at. It is related to our healthcare reform efforts. And I'm also putting in a bill that I think will continue our work that will help improve affordability, access, and quality healthcare, whether it's within hospitals, primary care practice, community social services, or other services. We have a lot of work to do. We need to look at specifically IT. I'm looking at you for that, your interest there. That we need to integrate the health data acquisition and analysis, assessment that is utilized for clinical improvement. So we'll be trying to get at some consolidation, not really consolidation, but collaboration and systemic improvement to align those issues. And the bills that we have really, you know, they don't flow, but they do tend to put in place some of the needed technical or other corrections that will help with healthcare reform. People are spending way too much money on healthcare, and it's not any single entity's fault. It's not the hospital's fault. It's not the primary care fault. It's not the specialist's fault. It is a problem with our system. And so we're going to continue to identify ways to improve that system so that we can reduce the burden on our constituents as they seek health care. And part of that is all about that word equitable, and equitable reimbursement and equitable access and equitable outcomes. So we want to reduce the inequity that we have in the system. So those are three areas that we'll be working on, among others. Obviously, there are some bills that the House still has of ours that we would like to have come back to us. One is your chemical bill, and the other is what's going to happen with kids in school and vaping. So we'll be looking for those bills. There are other areas of work that the Justice Oversight Committee has done. You know, we met briefly with them on whatever Act that was. What Act was it? Anyway, 27. Oh, it was Act 27. Yeah. On looking at who provides competency evaluations. We will look at competency evaluations again and whether or not we should have competency restoration in the state. So we'll get back into our thinking again with the judiciary about that. We'll also be considering the need for a forensic facility for those with intellectual disabilities and mental health issues. There was a lot of discussion as a result of Act 27 on that as well over the interim months. So we'll get back to that. So let's see what else. There was another thing that I was going to mention before I stopped. Keep chatting anyway. Yeah, I think that's good. Whatever I forgot, I'll remember. It'll all be back. Well, I don't know. How does that resonate with each of you? I'm just going to let each of you just sort of talk a little bit. We can have a discussion about what you're thinking. See where we go. We've got bills that are coming in. We have a mile-long list. We did an excellent job last year of completing all the work on all of the House bills that we got, I think. So now my goal is to wait for the Senate bills to come back to us before we act on House bills. And I will state that publicly because I know there's an interest in having a specific House bill passed very quickly. That may not happen right away. We'll see. All right, so floor is open for conversation. Ruth, I know you're working on some bills. You want to?
Sure. So I think that's a great list that you just listed. That's where it sounds like we're going to solve all the world's problems. That sounds great. So let's do it. And the two of the things that I've been focusing on in the off session are, one, I serve on the Opioid Settlement Advisory Committee. So we've dug in really deep into a lot of harm reduction, prevention, and recovery type services. And we have our preliminary recommendations that are being written up right now by the Department of Health. And so that should be finalized within hopefully the next week or so and would be sent to the relevant chairs and hopefully included in some form in the governor's budget. There's not as many funds in that fund as we had been hoping. The settlement funds are getting slow, coming to us much slower than we thought they would. So we have maybe 5 million and some big ticket items that we're trying to look at. One of my priorities as a senator that represents a more rural district is that the funds be equitably distributed across the state. And there's a huge crisis obviously in Burlington, and we're very aware of that, but there's a crisis everywhere. Proportionally, there are higher overdose deaths in the rural areas of our state. So I've been sort of the voice on the committee saying, hey, don't forget about the rural areas, while we're also trying to take care of the situation in Burlington. So that's been a major focus, and we'll be eager to make sure that we take a good look at those funds, but the broader issue even beyond what we're able to fund with the settlement funds. And then the second thing that I've been working on with Senator Lyons and Representative Houghton in the House is a major bill on Medicaid. So that should be out in the next week or so. I think that the House is going to take a look at it first, is my understanding, and then hopefully we'll have a chance to take a look at it in here. But really just trying to find a way to make healthcare more accessible and affordable, especially to people who are right now living with very minimal means, but they are above the eligibility for Medicaid, and those are the Vermonters that tend to be underinsured. So this bill would really target trying to take care of people who are underinsured and across age categories as well. and also includes a provision related to the Medicare cliff. So once that bill's out, I'm happy to talk to you about it. And
As soon as the House gets it to us, that'll be great, yeah.
Yeah,
Good. And
yeah,
I know
so-
that I think Diva is working on something in that area.
Yeah, so, those are my two priorities that are more than but I'm also very excited to dig back into the sort of systems reform. And there's a bill that I think Senator Lyons and I will be working on bills that overlap between my afternoon committee, the Government Operations Committee, and this committee, one being the Office of Professional Regulations. There are a couple things that are healthcare related that we'll work on together, and then also reorganization of the Agency of Human Services, which was just introduced today and sent to GovOps. So we'll be taking a look at that as well.
Okay, good, thank you. And then on the opioid settlement monies, it's my understanding, and I mean, you probably know this better than I do, that because of the debate at the in the federal courts about how that settlement is being settled, whether or not to start over or not. If it starts over, then the settlement monies would be reapportioned differently. So the money we're getting is just from the places where the settlement's been made, and no one is debating it in the courts. So
yeah, and one of the biggest ones is the one that's held up,
the
the
Sacklers.
Sackler one. So that's why we have fewer funds, less money than we thought we would have.
Thank you for that correction.
Thank you
Yeah.
for the correct grammar.
Fewer,
It's a grammarian.
one of my grammar pet peeves, so I have.
Me too.
Mine too.
Yeah.
That was the other thing I forgot. Now I remember, but I'll hold it for later. So who else?
I mean, since the women are going first, I'll just continue.
Yeah, go for it.
So housing, homelessness, obviously, I live in Burlington, and when I drive in, the tent city that is growing on Battery Street is just astounding to me, and it's such an inhospitable place for folks to be living that it does seem like a humanitarian and obviously a health crisis. It's right on a very busy street, so between the noise and the fumes, it's got the lake behind it, so the cold wind blowing off the lake just seems anyway, I feel for the folks who are there, and I hope we can find a solution to this. And I really, really was thankful to have the joint meeting this summer. I thought that was a great way to bring people together, set a tone and an intention for the coming session. I thought that was great.
Was that in the summer? Wasn't that over?
I'll just say off season, because it's all blending together. I have no idea.
We couldn't do it during the flood.
Sometime in the off-season.
We couldn't do it during flood recovery.
Right, it's either on or off. And then we were talking a little bit about something that I felt was going to be relevant to our education committee. And now, it's health insurance. I sit on a school board, and we're looking at almost a 17% healthcare increase to our school budgets. And, so this is something that is seeping into all areas of life, whether we like it or not, and something needs to be done. So thankful. Sorry.
Yeah. No, it's great.
I sadly lost someone to suicide in the off session, and the mental health crisis has really hit home for my family. And one of the things one bill that's still up there is looking at creating an advisory for psychedelic therapy. And however you feel about that, one thing that I like about it is that it's doing something different that we haven't done yet. And when we keep doing the same things over and over again, and we don't see the improvement that we want, it seems like it's time to try something new. And so I hope that it's something that we can look at. There's still the Medicaid coverage for doula services up there, which I think is also very important. We know that getting kids started on the right foot is incredibly important, and this is a great way to do that.
So, yeah, good. Thank you for bringing up S
Yeah.
214, because I did meet with some folks about that at this time. We will. There you are.
And that's it. Thank you for
Thank you
listening.
for your good work in the Senate floor this morning. No problem.
I'll pass it on to the gentleman.
So the 214,
Yes.
the psilocybin, we'll take some testimony on that and sort out what's possible there. And the report is coming back from the medical school and the Cannabis Control Board. And a little working group on some other drug areas. And I talked with the dean of the med school about helping us out with this, and he was happy to do that. So we will do that.
Awesome. And there is a workshop coming up that everyone should have gotten an email about that.
Yeah. And then the other one that you mentioned on the dualist, we can probably look at that. Might be. There's always ways of merging.
Right.
There's good ways of
Merging is
things
good.
in here. That's what makes it fun. Okay. Oh, okay. So who's first?
My senior college.
Dave wants to go last.
David.
Yeah, you could have saved it.
Senator Rich always wants to go last, but that's okay.
So I don't have anything prepared, but, because I'm not on any other committees
Yes.
during the summer,
Yes.
I've taken the opportunity, to actually get on the ground. Got involved with homeless prevention and with the housing in Rutland County. And because Senator Weeks and Buick and I are all in the education committee, I realized that education is key to the problems with health and welfare. So, it's been, pretty eye-opening to me because I've never had a problem with healthcare because it was always provided for me in my previous life. And, to see the people that don't have it, it's hard to not get compassionately involved with them. Number one, but it's a conundrum. We keep treating the symptom and not the problem. I have a tendency to oversimplify everything that, because that's pretty much what I used to do is I'd take a look at something and say, I can see a problem, it's, X, but in reality, it's not. But we need to get government at all levels involved. We need more senior healthcare facilities, nursing homes. And it used to be when I was a child, every town had 2 nursing homes. That's what they called them at the time.
Yeah.
And the community was involved. People volunteered there because they had the time. We don't have that anymore. And a lot of the problems we've got with homelessness happen to be seniors that should be in a nursing home. And not shouldn't be in a hotel motel situation. So it's a vicious cycle. It affects public safety. And we keep treating the symptom and not the problem. We need to sit down and actually look at what we can cut right now. I'm a conservative, so I always look at a way to stop throwing money at it. But people out there really need our help, and when they realize that I'm a senator and I'm willing to listen to them, they come to me, and it's overwhelming. So I didn't ask to be on either of my 2 committees, but I'm glad I'm here because I can see where I can actually help. So
Good. Well, you're going to be in the thick of it. And we appreciate.
Yeah, I can tell. I just saw the list of bills. And
we appreciate your interest in that. That's good. All right. Okay, that's great.
So I'll jump in.
Yeah.
So I remain humbled by the mission of this committee and the work that you guys, Senator Lyons and Senator Hardy in particular, have done for years prior to our gaining access into the committee. So the work is very, very relevant to Vermonters, and I'm humbled by what was accomplished last year. I'm humbled by what's on the board and what's coming back through the House, and the list of bills which we saw drafted this morning, and all of the subject matter experts that advise us. You know, it's invaluable, because this is not a topic that I think Terry and I have background in. So it's very valuable. And of course, Senator Lyons' leadership is paramount. The only topic that I see missing from all of these bills, again, is the same topic I brought up last time, is obesity. I think it's symptomatic of a bigger issue, and deserves a look, and because it negatively affects our healthcare system and negatively affects our state budget, our treasury. So as one of our colleagues very astutely pointed out at the end of the last session, we all agree on 85% of what we're doing. It's that 15%. We actually all agree on the intent. It's just how we fund it and what have you. So I remain a student of health and welfare, but I certainly appreciate your wisdom and your guidance as we move along, in particular subject matter experts.
So there's actually a bill that was introduced today that was sent to finance on obesity care. And I wish I had remembered that you were interested in that, because I would have asked you if you'd wanted to co-sponsor it, but it.
No, I did see that.
Yeah, so that, it was because it's insurance related.
It is. I pulled that aside and I kept that.
Is it Ozempic? Is it the Ozempic?
It's insurance coverage for obesity care more broadly. Senator Ram Hinsdale and I introduced it, but
we might have to look, we'll have to look at that once it gets going.
It's not similar to the doula bill. It's just
right.
Broader, I think.
Might be able to
it's coverage for it. Yeah.
So, and just your interest is an interest that is shared. So the first big bill that I passed, I think, I forget which one it was, but in my first session 100 years ago was, or nearly there, was, oh, you get one too, Senator.
This S5?
What is that?
That's our work for Thursday mornings
Oh,
at
it's the
8 o'clock.
Okay.
The CHAMPS bill, the Coalition for Healthy Activity, Motivation and Prevention Programs, which was a prevention program to improve health outcomes and reduce obesity in the state. And from that, we've continued to work on prevention, and then moved into the whole arena of adverse childhood experiences and preventing those, and then the social determinants of health. That all wraps in together. So I'm with you on moving further on that, and I think the Department of Health is also, they have been for many years. We also, when we did that bill, I also worked with the folks in the Agency of Education, and something that we can talk about, because you guys are in education, to put in place physical activity 30 minutes a day, or how many days a week for kids. Without that, kids sit. So I'm encouraging you on education, because now that's an interest of yours, to get that in as part of the standard curriculum. The agency has always said, oh, leave it to the local districts, because they don't have time. And some kids are on teams. Well, the kids who are not on the teams are in front of the computer. Anyway, so I won't rant about that, but I think that you have an opportunity beyond covering it, to try beyond treating it medically. And if it is covered in insurance, it should be treated through counseling as well as medically. Medical treatment is insufficient. So don't get me passionate about this one.
Good. We lit the fire.
You have lit the fire. So anyway, so I'm happy to help with that one any way we can. Go ahead.
Quick question, when do the new federal poverty levels come out for 2024?
Oh, good, we'll ask Nolan that question. I'm not sure. I don't know, are they out? Not yet.
It's kind of.
They'll be up there as soon as we get them.
Great.
All right, so, yeah, you all have great ideas, and I know you're equally passionate about things, so we can sort things out and put it in order. One of what I'm hearing, one of the things that I didn't hear and that I failed to mention myself is S98, which is prescription drugs, and how to put a cap on high-cost prescription drugs. I'm been working on that. I'm working today with a remote meeting with some people. There are many states, several states, that have started an advisory committee on prescription drugs and have the authority to put caps on cost for specific high-cost drugs and others. So we will look at S98 and see how it fits with Vermont and what's happened in other states. And we're going to do that pretty quickly because it might fall into and fit with the healthcare reform bill that we're looking at and the Green Mountain Care Board and some of the changes that might have to happen in that board to regulate drugs and how it might fit with Medicaid and the PBM that Medicaid currently has is so effective at regulating drug costs. So we will have that bill, and because high drug costs are one of the reasons that we see high insurance premiums and that we see high hospital costs and we see high out-of-pocket. So we can't ignore that, and we can't put blame on our providers or our insurers when those prescription drug costs are there. The other thing I heard was the need for focusing on rural areas for kids, for substance use disorder. And I do know that in a place like Addison County, where they have, in the middle school, they have counselors, but they have insufficient support. And they have insufficient support in many parts of the state for kids, for counseling, support services, and meeting with kids and helping the ones who need it the most, and some of those who have significant health problems, including obesity. So we have a lot to do. I don't know how we add money to local school boards for counselors, but maybe there's some incentives we can provide going forward that would, jumpstart it, put a new spark plug in place. Yeah.
The ESSER and ARPA funds were really helpful for some districts. They use those monies for extra counselors and social emotional learning. And I mean, it was just really, really helpful. And with that leaving, it's another burden.
Yeah, it's what's happened to small businesses, it's what's happened to hospitals, it's what happened to schools, and designated agencies. It's all just sort of the cliff. And we can't afford to fill in that gap. We just can't do it, but we need to be creative. And so that'll be, it is an appropriations problem, but it's also a policy issue. Having coordinated systems is important. What else is there? Here's the problem. Too much to do and too little time.
Yeah.
And great ideas. And great ideas all around the table. So when you have your bills come in, I didn't mention the technical correction bill for childcare. We'll look at that. Whenever you pass a big bill, there's going to be places for improvement. So there is a bill on that. We'll look at that. It would be great if Vermont won the lottery. Well, yeah, okay. Anything else? This week it'll be, we'll start to get our feet wet with some of the reports that are coming back to us. And we'll start looking at some of the bills that we do have from Katie and Jen. And we'll look at the reports from folks from DCF or, mental health. The Act 27 report is probably something we should look at, because it touches both the forensic facility issue and the competency issues that we have been working on. And we have a letter from Joint Justice Oversight, I think, that we need to see with that comes. What else? Anything else? Yes, sir.
One more thing, in my travels around the county, words matter. And one way to simplify a process is a common language. There's so many acronyms. Some of them flow over into other functional areas that they use the same thing. It's very confusing to the people that have to set policy and make decisions. It's too bad we didn't have a acronym and definition section or committee within. I'm serious. You just spewed off a whole bunch of terms that you know what they are.
You already know what they are.
Well, I do when you talk about them.
Yeah.
But it's easy for me to forget because I got other things in my head. But,
well, so we do have somewhere a list of acronyms that relate to our committee. And I'm going to ask our committee assistant to access that and to get that to us. And maybe we could get a little printout of that and cover it in plastic. So
It might be on our website, because every year it feels like we talk about this at the beginning of the session.
So can you find that, and Alex maybe can help access that?
and, you know, things we say and terms we use mean different things to the experts, you know.
Yeah, okay,
So. Yeah.
point taken. Good idea.
It's to the SMEs.
SMEs, subject matter experts.
SME, so let's use that
Did I
now.
say CSAC? I did not say that. I said Addison County Education Counselors. So I was thinking CSAC in my head, but I didn't do that because I knew it was difficult.
We would not
Just
know.
like CSAC for Chittenden County. Okay. Well, yeah, they're gonna, and we have overlap in here with judiciary, finance, economic development, and education big time, and a little bit of natural resources. And transportation.
Since you brought up judiciary,
Uh-oh.
there's a lot of talk about a new women's prison, and I'm wondering if that is something that ever comes to us, because a lot of folks want to have a facility that has wraparound services that provide, right? And also, not to mention, you know, addiction is substance use disorder is a big part of this. Yeah, okay, so I just wanted to bring that up.
Yeah, darn, I wish you hadn't. No, that's good. That's another big deal. Yes, we did in the past. I personally have taken an interest in the women's correctional facility, because it has been in my district. It's still in my district. And the health and the cleanliness of that place. So we'll try to take a look at that. I don't know that we'll have a bill in here that belongs to us, but we can offer advice in some way. It will go to institutions. That's where and it will be in judiciary, where Department of Corrections policy is. But we will put our fingerprints on it, and here's how we'll do that. The Justice Oversight Committee has decided that health and welfare committees of House and Senate should look at healthcare away from contracted health care. And so what you're talking about is part of that. So not only the MAT programs, the medically assisted treatment, methadone and some other medical treatments, but also looking at overall healthcare and how the state might do that rather than contracting with Wellcraft right now is the organization, but nobody is really, I'm not. Thank you for bringing that up. Okay, what else is there? Anybody else want to fill our agenda? Okay. All right, well, I'm happy to end if you are. Okay, and Senator Weeks has volunteered yet again to be point person for nominations.
Sure, all over it.
Oh, yeah, like that huge pile was probably half ours, right?
What's that?
The huge pile was
Yeah.
probably half ours.
Yeah, we'll work with it, divvy it up. Okay.
And if we come up with like boards and commissions that don't need to exist anymore, just let me know. We'll take care of that and go.
Oh, look, that's a good point.
I'm
Yeah.
serious,
Yeah.
I'm serious, like, there are so many things, or ones that we should merge. I mean, I have a vehicle for that if we come up with something,
All right, sounds good.
yeah.
You're on it.
Good.
Yeah, let me know as you're sorting through.
Well, we'll talk about it in here, and then we'll send it to GovOps.
Yeah,
So-
well, yeah.
So is there a target date to have these all done by?
Sure.
But we were still,
Yesterday.
we were still messing
May
around at the end of the session.
They're already doing their jobs
Right.
and we just.
Yeah.
Supposed to
A
be.
lot of them didn't.
So first we need the package, and then we'll go. We'll talk about a date.
Yeah, we'll figure it out. We'll find some
Are you gonna do
downtime.
another color coded?
You betcha.
Oh,
Make it simple.
that was one of my favorite charts from last session.
It was nicely done.
Well, okay, anything else? That's good, so acronyms and nominations and a full agenda.
I was just looking for the acronyms thing on our website and I don't find it
I don't know
specifically,
that,
but.
yeah, I don't know that
I
it's
can
there.
provide some guidance. If the annual report from the Department of Vermont Health Access is available, which I think it should be from sometime in January last year, it is in the back of that. Or if any of you happen to have your nice binder from last year that was lovingly
Yeah.
prepared by the department, that has it in the very back. You will get
So
it.
that has a lot of them, but there are some that are missing from that.
Yeah,
but
there's
we'll-
the,
so-
there is the
yeah.
annual, under Department of Vermont Health Access, there's the Clinical Utilization Review Board Annual Report and the Specific Home and Community-Based Service Provider Report. Rate Study Report.
Oh, I'm sorry, it's not under reports, it's under a witness document. We
Oh.
call
So,
it an annual
well,
report.
look at,
It's
we'll
not
sort
required.
this out, we'll
All
sort it out. What we'll do right now is we're gonna close our committee meeting, we're gonna go off live, and then we'll be set to go tomorrow at 9 AM.